worry and fear is something which keeps us going. When we don't have any worry, any anxiety, then we are kind of like, not motivated to do anything. But at the same time, if it becomes too much, then it starts affecting our life quite negatively.
Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Yusuf Iqbal. He is consultant psychiatrist. Welcome, Dr. Iqbal, to Faith and Discipline podcast.
Thank you so much for inviting me.
Worry and fear to some extent is actually good for us. It can help us protect against real danger. But when and why does it become a problem?
Yeah, thank you so much, sir. Very helpful question. So you're right. Worry and fear is something which keeps us going. But if you actually look at it, too little or too much of it, can be counterproductive. When we don't have any worry, any anxiety, then we are kind of like, not motivated to do anything. But at the same time, if it becomes too much, then it starts affecting our life quite negatively. So when that happens, when it affects our relationship, our work, we are quite distressed by our worry and anxiety, then we'll call it a disorder.
How can it affects us? How bad it can be?
So unfortunately, it can be quite severe and it can become pathological. The symptoms can make us very distressed. They can affect us in a way that we will not be able to do our day-to-day activities, affect our interaction with other people. It might affect our work, our studies. It can be extremely unpleasant.
Okay. And what are the reasons of anxiety? Why does it happen?
So normal fear and anxiety is just a normal physiological process. There are certain reasons. There could be genetic reasons, and there could be sometime kind of like, environmental reasons, stresses in life and all that. That could sometimes make us more vulnerable to develop anxiety disorders. It could be that there is anything stressful that's happening in our life, or sometimes not even stressful thing. Sometimes very positive big event can also trigger then anxiety symptoms.
What are the chances of someone to suffer from it if it runs in their family?
So the chances of anxiety disorders are higher if there's a family history of anxiety disorder. In general population, if you take a disorder like generalized anxiety disorder, it's like 1 in 25 of us will experience that. But if it runs in families, if there's a close family member who suffers with similar problem, then the chances are increased like 4 to 6 fold. And similarly, there are other anxiety disorders where the risk will increase.
Okay. What is panic disorder?
So panic disorder is a specific type of anxiety disorder where anxiety will come in an episode. So there will be, a severe attack of anxiety, which might include physical symptoms, including, our heart beating very fast, hyperventilating, sweating and shaking, and fear that something awful is going to happen. Often, patients will tell us that I worry if I'm going to have a heart attack, I'm going to die, and that attack typically will last for a few minutes. It can happen quite frequently. And even when patients are not experiencing these attacks, they still will have a worry, what if I'm getting another attack? And these, symptoms, if they continue for at least 2 weeks, then we will call it a panic disorder.
Okay. What are other forms of anxiety other than panic disorder?
So there are phobias, specific phobias, something which is quite kind of like commonly known. So people might have, for example, phobia of spiders. People might have a phobia of enclosed places, being in public places. Then, there's condition called social anxiety, So basically people have anxiety being in social situation, being around people. They feel they're going to be judged, so that actually leads to increase in the anxiety symptoms. As a result, they will avoid that situation because they think, this will help with the anxiety symptoms. Then there's a specific kind of anxiety disorder like post-traumatic stress disorder after a significant trauma, and other kind of anxiety like obsessive compulsive disorder, which can also be clustered under anxiety disorder.
What are the effects of anxiety on our physical and mental health?
So basically, anxiety disorder is classed as a mental disorder. A high level of anxiety and stress has a deleterious effect, very negative effect on our both our physical and mental health. So we know that patients who experience significant anxiety disorder end up with more complications. Similarly, with anxiety disorder, people might actually have negative lifestyle. For example, they might unfortunately resort to unhelpful ways of coping with it, like drinking alcohol, to relax, which actually can compound problems. Furthermore, it can also have a negative effect on engagement with services. For example, patients may not attend their appointments very regularly because of the significant anxiety that they've been struggling with.
Okay. And are there any serious health conditions like heart problems, diabetes, or stomach ulcers? Is there any link?
So there's definitely a link, with chronic medical condition and anxiety disorder. So there's link, for example, with peptic ulcer disease. There's a link with that. There's a link with most of the chronic health condition. How the anxiety disorder can aggravate, the symptoms of underlying physical health conditions.
I want to know what is the link between anxiety and poor sleep and anxiety and exercise.
Anxiety and sleep are closely linked because sleeping difficulties can be symptoms of anxiety disorder per se. So people might struggle to fall off to sleep, or they might actually have interrupted sleep. So they will sleep, but it won't be refreshing, and they'll wake up repeatedly, which can have actually a negative effect on the daytime, activities and alertness. Similarly, if the sleep is very poor, functioning is impaired, it can make anxiety symptoms worse as well. And as far as the exercise is concerned, we know that exercise will have a positive impact on anxiety symptoms, as we know that exercise will release endorphins, which are quite positive for our mood and for our well-being. So in terms of one of the management strategies, we will advise that people do regular exercise.
How do we diagnose anxiety based on the symptoms and give it a proper diagnosis?
So if we are talking about a disorder, a disorder will include a collection of symptoms. So for example, if you're talking about generalized anxiety disorder, a patient will tell me that they've been struggling with excessive worry and feeling anxious without any reason, that have been bothering them for at least 6 months. And then it's associated with other symptoms. For example, we mentioned sleep. Similarly, concentration, energy level could be impaired. People might tend to become quite irritable, and little things will kind of like trigger them off. They can have physical symptoms, for example, palpitations. They might experience shortness of breath, sweating. So if a collection of these symptoms have been present for a period of time, and then that is affecting their life, i.e. their work, their personal social life, then we will class it as a generalized anxiety disorder. And similarly, there are criteria for other disorders as well. Like I was talking about panic disorder, the symptoms being present for at least 2 weeks, and such like.
Okay. So what are the treatment options? And these treatments, do they actually cure the problem or just to manage it?
So anxiety disorder is very treatable condition. This is definitely a message I want to convey through your videos. So treatment options are depending on the severity of anxiety disorder. So if the symptoms are mild to moderate, we'll advise self-help, exercise, support from friends and family, similarly psychological therapies. If the symptoms are more moderate to severe, then medications will also come into picture. In terms of it being whether there is a cure for anxiety disorder, if you're talking about disorders, like generalized anxiety disorder and all that, some people do quite well, but we cannot call the treatments as curative treatment as such.
Okay. Can you tell us more about CBT? And how long CBT sessions last? How many sessions are required?
Yeah, so CBT stands for cognitive behavioral therapy. Cognition here means our thoughts, the way we think about it, and of course behavior is how we behave. So we know that our thoughts have a profound effect on our emotions and on our body symptom and our behavior. So, if for example, I'm walking down the street and I come across someone that I know, I say hello to them and they don't reply back. So I can think that, oh, they're ignoring me, and that might make me feel a bit sad, a bit upset, really. What it will lead to is that next time I will want to avoid that person as such. It will affect my behavior. So, as you can see, it's a vicious circle. It might lead again to me reinforcing my negative beliefs. However, if I think maybe he didn't hear what I said, or maybe he's preoccupied and all that, that will not have the same negative cycle. So what we do in cognitive behavioral therapy is try to target the negative thoughts and try to help our patients to think more in a balanced way. Thinking and looking at kind of evidence for each thought that we know has a positive effect on our emotions. Similarly, we can do that through the behavioral part, i.e., if I have got significant phobia of going out and socializing, I slowly will work with my therapist to imagine going out, then just going out of the door, and then slowly with support gradually going to the town center and all that. So I slowly desensitize myself. So we're working on both these domains, cognition and behavior, which ultimately has been proven to be very successful in terms of treating anxiety symptoms.
And how long these sessions last? How long is the course?
Yes, thank you for reminding me that. So the sessions usually they will last for about 45 minutes to an hour, and usually we would say about 6 to 12 sessions depending on the severity of the symptoms. Sometimes there could be more sessions.
So what happens after the CBT sessions? When the sessions are over, then the person is on their own. Do they need to keep practicing what they learned during the CBT, or they are just cured for life?
So basically, what happens later on in the sessions, the therapist will train the patient about relapse prevention. So as the symptoms start to improve, they will equip them with tools. So when you face this situation in future, how best you need to react. So the relapse prevention work, which is part of the CBT therapy, generally helps. But of course, nothing is 100% successful. People might still become unwell and relapse.
And let's talk about medications. Are there any medications for anxiety, and how effective they are? Are there any positive and negative effects of it?
There are very good medications that can be very helpful for different anxiety disorder. We have a medication called SSRI, which is commonly known. So medications like fluoxetine, sertraline, citalopram, they're extremely effective in terms of managing symptoms when our anxiety symptoms are quite severe. They may not be as effective in mild anxiety. Well, they're not indicated in mild anxiety disorders. They usually take some time for them to start working. And as with any medication, even if you take ibuprofen, it comes with side effects. So do these medications do. So some of the common side effects, when we first start taking it, it might make us feel a bit sick. Sometimes might actually paradoxically increase our anxiety and sleep disturbances, but then it usually settles down these kind of symptoms, these kind of side effects. In some cases, it might lead to sexual side effects, but if that happens, of course, you will need to consult your doctor, and then there are alternative options. So SSRIs, and the other medication we call SNRI, like venlafaxine, and there are other medications. These are coming an umbrella group of antidepressants. Some people use a short-term, medication called benzodiazepine, like diazepam or lorazepam. Generally, they are not highly recommended because they are more like a sticky plaster. They don't treat the underlying anxiety disorder, and they can be quite addictive, unfortunately. Hence, we will not recommend using it for longer than 1 or 2 weeks, really. And then there are other medications like propranolol. Sometimes, your primary care practitioner might prescribe to look to manage the physical symptoms of anxiety.
Okay.
Thank you.
And how long is the course? Is it for life they need to take it, or is it for a certain period of time?
So it depends on the type of disorder. For some disorder, we might say for about 6 to 12 months. But if someone's anxiety disorders have been quite severe and they've been happening on more than one occasion, then we might advise them to take medication on a longer term basis.
What is your recommendation? What lifestyle changes people can make that can help with their anxiety, or if someone wants to avoid it, so how can they prevent it?
So thank you so much. I think really important question in terms of prevention, management, kind of like, of symptoms before they become problematic. So just a healthy lifestyle. I really advise my patient, as well as my family members about the importance of good sleep, in terms of making sure you sleep regular, kind of like pattern of sleep and all that. I think really helps. Similarly, regular exercise, and whenever there is a stress problem, rather than sitting on it, trying to resolve it, trying to basically discuss it with your loved one, trying to be a bit kind to yourself. Sometimes we are a bit too critical of ourselves, so how kind of like we can be a bit compassionate about ourselves. And similarly, there are other things, being mindful of kind of like our day-to-day life. So those are some strategies which can actually help. And in terms of our studies and work, taking regular breaks, making sure if the problem becomes kind of like too much, you delegate, you share kind of like your work. Those kind of little strategies may actually help.
So you are trying to say is take a step back and come to terms with the problem, and just try to compromise with things rather than keep pushing for it and taking stress.
Well, I'm not saying to compromise. I was talking more about like kind of like trying to tackle the problem, rather than running away from it. Really, so tackle the problem and instituting preventative strategies, which are helpful generally for most of the mental health problems as well as for physical health.
Okay. Yeah. My final question is just overall recommendation because anxiety is one of the mental health issues. So in general, if someone wants to have a healthy mind, what they should be doing?
In terms of general mental health, similar advice as I gave earlier for anxiety disorder, really. Also, I think it's very important that we take away the stigma from it, and we don't pathologize the normal anxiety as well. So these are some of the factors. So if we all, for example, if I have an interview, or I remember before my important exam, I couldn't sleep very well the night before, really, and I was feeling very anxious. This kind of like normal anxiety that we all experience, right? And similarly, if I do struggle with a disorder, there's nothing to be, like I said, ashamed of. It's not something to be ashamed of. We know 1 in 4 of us will experience mental health problem in our lives. So it's important we seek help from our loved ones. And if we need to, if it is becoming problematic, go and seek professional help, see your GP, see your doctor, or get referred to mental health services. We are very happy to basically offer assistance, and do assessment.
Many thanks for joining us today. I believe the information provided our viewers find it very useful.
Thank you so much for having me.
Thanks for watching this episode. If you found this useful, please share with your family and friends. If you haven't already, make sure to subscribe to this channel. Thanks for watching.